Thank you all for attending this webinar. I'm so honored to have this chance to introduce the Alveo HP CTO Balloon caster. This introduction includes two parts to go deep into the Alveo HP Balloon caster from the R&D perspective. So first part is about Alveo HP. The Alveo HP is the world's smallest profile PCI broadcaster and is suitable for your first choice for CTO and compressed regions. It presents three characterizations for Alveo HP. First one is the with 0.75 millimeter in diameter. Alveo HP is the smallest high-pressure CTO broadcaster in the world. Second, specifically designed for crossing compressed lesions and chronic total occurrence, as well as checking tortuous anatomy. And third one is to combine several innovative technology in one. So this is the technical specification. The balloon diameter ranges from 0.75 to 2 millimeter. The balloon length ranges from 5 to 30 millimeter. The RBP is 20 ATM. And the average burst pressure is up to 28 ATM. So let's go further to the features of Alveo HP, which make Alveo HP a best CTO broadcaster. For CTO balloon, the most important and the most challenging thing is crossing. Once crossed, then the subsequent treatment could be performed. Bigger balloon for pre-dilatations, stand post-dilatation to achieve best outcome. And how to get better or best possibility. Grossman devotes to CTO balloon technology for over 10 years. We consider that this five factors will contribute to and form the possibility. Checkability, tip design, balloon profile, pushability, and coating. All is for the best possibility to cross the balloon uncrossable lesion. So first one is the checkability. Good checkability will be helpful for the balloon to follow the guidewire, especially for CTO lesions. So good checkability is considered as the first factor to get better crossability. How to get better checkability? We have three suggestions. First, minimize the gap between the tip and the guide wire to avoid such called fish mouths. Second, using flexible tip material. Third, try to get smaller tip entry profile. So how's the checkability performance of the Alveo HP? As the picture showed, Alveo HP and the Artemis had a smaller gap between the tip and the guide wire. So the tip could follow the guide wire into the lesion. However, for other brands, they had a bigger gap, which will get some difficulty in passing and crossing. So when we push the Alveo HP and other brand tip together, Alveo HP will be easy to drill into the other tip inside. Okay, so second is we consider that the tip design is also greatly contributed to the crossability. We use the proprietary balanced tip, distal tip technology for the Alveo HP. Material choice and design is the most important thing to improve tip crossing and tracking. We choose the flexible tip material so it would not crush during the entry into the stenosis lesion. We extend this flexible tip into the balloon to form a smooth welding joint, which will help the welding joint crossing. We also optimize the laser welding technology to eliminate the hardness and get the smallest crossing profile. So this is the Alveo HP tip profile. The picture showed so how the Alveo HP tip structure and profile when compared with other brand broadcaster. So Alveo HP is better in this picture. So with the balanced digital tip technology, Alveo HP gets the smallest tip entry profile when compared with other brands broadcasters. Smaller tip entry profile means the better crossing and checkability. And the smooth and tapered tip design result in the smaller crossing profile. That means once the tip cross, the balloon is also could be crossed with a smaller crossing profile. The Alveo HP is the best one. Okay. So once the distal cross, we need to consider the balloon profile. Alveo HP used the proprietary balloon forming technology. By this technology, Alveo HP solves the conflict between the thinner wall thickness and the higher burst pressure. Therefore, it has the smallest balloon profile, even with the highest RBP. The picture shows the better crossing profile when compared with the market device, Sprinter engine, and Emerge. Yeah. So Alveo HP adopt the optimized balloon material and the balloon folding technology. This results in superior rewrap for CTO region re-entry. As the picture showed, the preferred 3 wings rewrap shape of Alveo HP will help re-entry the region. So besides the profile, the pushability is another key point to the possibility. We made research of the pushability performance of competitors and designed the distal shaft and proximal shaft. We choose 2.2 French distal shaft to improve the checkability and crossability in tortuous region. We compared with other brands broadcaster. Alveo HP is the smallest distal shaft profile, which will allow better compatibility with other devices in sys-up guiding. Besides, the enhanced inner ribbon will eliminate guide-wide friction and to increase pushability. For the proximal shaft, we adopt the spiral cut hub tube design, which will transform the proximal shaft to distal shaft smoothly and effectively. Based on the above design, we test the pushability as the picture showed. We will measure the proximal force at the hub tube and distal force at the end of tip. Then we calculate the force transfer efficiency. Alveo HP gained bigger value, means the better pushability. We also simulate the pushability performance in the model. When we push the caster for a certain distance, the pushing force will be measured. The smaller force, the better pushability. Once again, the Alveo HP has better pushability performance. The final factor is coating. We use the dual hydrophilic coating applied on the outer surface and the silicone coating applied in the guide-wire lumen. The hydrophilic coating gives the durable and ultra-low frictional force, which will help with the crossing performance. You can see it in the picture when we prep the caster and we get friction for 25 cycles, the frictional force is still very low. Therefore, with the above 5 factors comparison, we test the possibility with a simulated stillness region. The Alveo HP performed the best. Yes, the lower push force means the better crossability. The Alveo HP is performed the best. Other brands were not able to cross since we simulate a stillness with a 0.0223 inch. So once crossing is set, what else could Alveo help? robust, the Alveo HP could be dilated to higher pressure, up to 20 atm, and average burst pressure 28 atm to overcome the hard lesion in CTO case. So Alveo HP will allow more safe dilatation and greater dilatation tension. That's more easier to dilate the stenosis. Furthermore, the puncture-resistant balloon material will reduce the probability of rupture during the treatment of calcified lesions. So, combine several innovative technology in one, Alveo HP is really a powerful weapon for CTO and compression lesion to cross the balloon uncrossable lesion. Thank you.